Hi, I'm Prichingi Tago, and this video will study the Echinococcus multitocularis. So, the Echinococcus multitocularis, it is a small cyclopilid tapeworm. The importance of the tapeworm is the cause of lethal disease. The disease resembles in the gamsa and it starts in the neighboring tissue and also in the different parts of the body from the cytolation. It is a most lethal helminthic disease, and the disease found in almost 30 countries, including Russia, Kazakhstan, China, parts of Europe, and North America. And the morphology of Echinococcus multitocularis and Echinococcus granulosus is almost the same. The adult worm compared to the Echinococcus granulosus is small and around of 1.2 to 3.7 mm. It has a head, neck, and body with 3 segments. The proglottids are mature proglottids and gravid proglottids. The gravid proglottids will be having the eggs. The eggs resemble other Rhytania egg. And the cyst is composed of many irregular cavities with little or no fluid, and often central necrosis and cavitation of the lesion. The life cycle of Echinococcus multitocularis is complex, involving of 2 hosts, the definitive host and the intermediate host. The definitive hosts are involved foxes, wolves, dogs, and cats. The intermediate hosts are the voles, field mice, house mice, ground squirrels, and shrews. The infection are transmitted by handling of infective definitive host or ingestion of contaminated food or water. Ingestion of soil, berries, or other vegetables contaminated with eggs may be less important in transmission. The other form resides in the small intestine of the dog, fox, and wolf. The egg and the proglottids, which are passed in the feces, will be ingested in the intermediate host. The egg, once ingested, will hatch, and longosperm will penetrate the intestine. Longosperm and carry the blood to the tissue, and the inside of the tissue, longosperm will develop into alveolar cysts. When infected, and the intermediate host is eaten by the dogs, wolf, and foxes. The proterscolitis will get to the other form, and the life cycle will continue. Man can get infection by eating the food quarter or directly handling the animals which are infected by the Echinococcus multitocularis. Again, similar to other intermediate hosts, the extensive by the human will get hatched, and longosperm will reach the tissue. Inside the tissue, the alveolar hydatid cyst develop. The infection among human, as the disease cannot transmit it from man to definitive hosts like fox, dogs, and wolf. So the clinical features. Infection usually occur in childhood and symptoms may appear after 20 or 30 years. The human disease can be divided into several stages. The initial stage, the disease may get spontaneously cure or progression. In progressive stage, the disease will infected into neighboring tissue. In advance, the disease with high mortality, unstable parasite growth, inhibited, abortive parasite dies, and cyst calcified. There may be hepatomegaly, splenomegaly, right upper abdominal pain with palpable hepatic mass. The mortality rate exceeds 90% if untreated. The diagnosis is all different upon the clinical suspension. When there is a strong clinical suspension, the imaging techniques will provide an immediate flow to the diagnosis of disease. When there's a high degree of suspension, the ultrasonography along the conjugated sonography is recommended diagnostic tradition. The contrast enhanced power Doppler sonography is almost having an equal efficiency in the ultrasonography and diagnostic tradition. The three-phase helical CT was able to visualize the vascularization associated by the Echinococcus Multitocularis. And we can do the fine needle aspiration. The cytologic smear are stained with May granule gimsa and periodic acid shift or PAS stain. Necrotic brown PAS positive hyaline cuticular structure are mucoid globule. The tissue section can be done on stain with hematoxylin and eosin and PAS. In tissue section, homogeneous, thin cystic structure of various dimensions were strongly PAS positive. Wide coagulative necrosis was seen in all cases, and there were foreign body type giant cells at the periphery of the lesion in some cases. So, this is the picture which shows diagram of disease from intermediate host and the disease from the human being. So, the treatment includes the total surgical removal, but it's impossible as there is no cups. In early stages, radical surgery may cure the disease. When in advanced cases, the effectiveness of surgery dropped. Enzyme therapy has given the following surgery. The mebendazole and albendazole are drugs of choice. The IFN gamma with mebendazole can halt disease progression. Usually, the prognosis is usually very grave. So the prevention, educating the children, strict personal hygiene, avoiding direct or indirect contact with dog or foxes spaces with animals should be treated with praziquantel. And thank you for watching this video.